Our bodies are incredible machines, constantly working to keep everything functioning correctly. One of the most important aspects of this balance is our blood sugar level. Blood sugar, or glucose, is the primary source of energy for our cells. We get glucose from the food we eat. Our bodies carefully regulate this level to ensure a steady supply of energy for our organs and muscles. However, when blood sugar levels drop too low, it disrupts this delicate balance and can have significant impacts on our health and well-being. This condition is known as hypoglycemia, and it's something we need to be aware of and understand how to manage. Hypoglycemia, also known as low blood sugar, occurs when the glucose in your bloodstream falls below a healthy level. This is typically defined as a blood glucose level below 70 milligrams per deciliter. While hypoglycemia can affect anyone, it's most commonly associated with diabetes, particularly in individuals who take insulin or certain medications to manage their condition. However, it's important to note that people without diabetes can also experience hypoglycemia due to various factors, such as certain medications, medical conditions, or prolonged fasting. Recognizing the symptoms of hypoglycemia and understanding how to manage it is crucial, as untreated hypoglycemia can lead to serious complications. In this video, we will delve deeper into hypoglycemia, exploring its symptoms, causes, and management strategies for both at-home care and hospital settings. Hypoglycemia doesn't always present itself in a dramatic fashion, especially in its early stages. Often the initial symptoms are subtle and can easily be mistaken for something else. One of the most common early signs of mild hypoglycemia is sweating. You might find yourself perspiring more than usual, even if you haven't been physically active or in a hot environment. Accompanying this, you may also experience shakiness or tremors, particularly in your hands. This feeling of tremulousness can be quite unsettling and is your body's way of signaling that something is amiss. Hunger is another telltale sign of mild hypoglycemia. You might feel a sudden and intense craving for food, even if you've recently eaten. Additionally, you may notice changes in your mood, such as increased anxiety or irritability. These emotional shifts can be attributed to the brain's dependence on glucose for proper functioning. When glucose levels dip, it can affect our emotional regulation. As hypoglycemia progresses from mild to moderate, the symptoms become more pronounced and difficult to ignore. Confusion and difficulty concentrating are common indicators of moderate hypoglycemia. You may find it hard to focus on tasks or follow conversations. This cognitive impairment occurs because the brain isn't receiving enough glucose to function optimally. Weakness and fatigue often accompany the mental fog, making it difficult to perform even simple physical activities. You might feel drained and lethargic, lacking the energy to go about your day. In addition to these symptoms, moderate hypoglycemia can also manifest as a rapid heartbeat. Your heart may race or pound in your chest, even when you're at rest. Furthermore, blurred vision can occur as the lack of glucose affects the eye's ability to function correctly. You might experience difficulty seeing clearly, with objects appearing hazy or out of focus. Headaches are another frequent symptom of moderate hypoglycemia, ranging from a dull ache to a throbbing pain. Severe hypoglycemia. Symptoms. Severe hypoglycemia is a medical emergency requiring immediate attention. It can lead to life-threatening complications. Seizures are a serious symptom. Loss of consciousness is another alarming sign. Untreated severe hypoglycemia can result in death. Immediate medical intervention is vital. Take immediate action to raise blood sugar levels and seek medical help. Section 1. Prompt action. Addressing hypoglycemia at home. Experiencing hypoglycemia can be unsettling, but it's crucial to remember that in most cases, it can be managed effectively at home. The key is to act quickly and appropriately when symptoms arise. The first step is to confirm that you are indeed experiencing hypoglycemia. If you have a blood glucose meter, check your blood sugar level. A reading below 70 milligrams per deciliter typically confirms hypoglycemia. However, even if you don't have a meter handy, don't hesitate to treat for hypoglycemia if you experience symptoms and suspect low blood sugar. It's always better to err on the side of caution than to delay treatment. Remember, untreated hypoglycemia can quickly escalate and lead to more serious complications. Therefore, prompt action is crucial. Once you've confirmed or strongly suspect hypoglycemia, it's time to take immediate steps to raise your blood sugar level. This involves consuming fast-acting carbohydrates, which are quickly absorbed into the bloodstream and provide a rapid boost of glucose. Section 2. The 15-to-15 Rule. A simple guide to treatment. The 15-15 rule is a widely recognized and easy-to-remember guideline for treating hypoglycemia at home. It involves consuming 15 grams of fast-acting carbohydrates and then waiting 15 minutes to recheck your blood sugar level. Fast-acting carbohydrates are found in various forms, making it convenient to find something suitable regardless of your location or preferences. Some readily available options include glucose tablets, which are specifically designed for treating hypoglycemia and typically contain 15 grams of glucose per tablet. Fruit juice, such as orange juice or apple juice, is another effective choice, providing a quick source of natural sugars. Regular soda, although not the healthiest option, can also be used in a pinch due to its high sugar content. If you prefer a more natural approach, honey or sugar can be consumed, with 1 tablespoon providing approximately 15 grams of carbohydrates. The key is to choose an option that you have on hand and can consume quickly. Section 3. Stabilizing blood sugar follow-up measures. After consuming 15 grams of fast-acting carbohydrates, wait for 15 minutes and then recheck your blood sugar level. If your blood sugar has risen above 70 milligrams per deciliter and your symptoms have improved, you've successfully treated the hypoglycemic episode. Follow up with a small snack or meal containing complex carbohydrates and protein to stabilize your blood sugar levels. Complex carbohydrates, like whole grain bread and brown rice, provide a sustained release of glucose. Protein, found in lean meat, beans, and lentils, helps regulate blood sugar by slowing glucose absorption. Combining complex carbohydrates with protein prevents rapid blood sugar fluctuations and provides sustained energy. Preparedness is key essential tips for managing hypoglycemia at home. Always keep quick sources of glucose available. Store glucose tablets, juice boxes, or honey sticks in various locations. Wear a medical alert bracelet or necklace. It can be life-saving in emergencies. Inform family, friends, and co-workers about your condition. Knowledge is power. Section 1. Emergency response. Managing hypoglycemia in a hospital setting. While most cases of hypoglycemia can be managed effectively at home, severe episodes often require professional medical attention. Hospitals are equipped with the resources and expertise to address severe hypoglycemia promptly and effectively, ensuring the patient's safety and well-being. Upon arrival at the hospital, the patient experiencing severe hypoglycemia will be promptly assessed by a medical team. This team, typically consisting of doctors, nurses, and other healthcare professionals, will work swiftly to evaluate the severity of the situation and initiate appropriate treatment measures. The initial assessment involves gathering crucial information about the patient's medical history, current symptoms, and any medications they are taking. This information helps the medical team understand the potential causes of the hypoglycemia and tailor the treatment accordingly. In addition to a physical examination, blood tests will be conducted to measure the patient's blood glucose levels and rule out any other underlying medical conditions. The medical team will closely monitor the patient's vital signs, including heart rate, blood pressure, and oxygen levels to ensure their stability. Swift and effective. Immediate treatment protocols. Treating severe hypoglycemia involves administering intravenous dextrose, rapidly raising blood glucose levels. Intravenous dextrose delivers glucose directly into the bloodstream for a rapid response. The medical team monitors blood glucose levels to ensure they stabilize. If IV access is unavailable, glucagon may be administered to raise blood sugar levels. Vigilance is key. Monitoring and aftercare. Once the patient's blood glucose levels have stabilized, the medical team will continue to monitor them closely to ensure they remain within a safe range. This may involve regular blood glucose checks and observation for any recurring symptoms of hypoglycemia. The duration of monitoring will vary depending on the severity of the hypoglycemia and the patient's overall health status. In some cases, patients may require admission to the hospital for observation and further management, particularly if the hypoglycemia was severe or caused by an underlying medical condition. During the monitoring period, the medical team will work to identify the underlying cause of the hypoglycemia. This may involve reviewing the patient's medical history, medication list, and lifestyle factors, such as diet and exercise habits. Identifying the cause is crucial in preventing future episodes of hypoglycemia and ensuring the patient's long-term health. Before discharging the patient, the medical team will provide comprehensive education on hypoglycemia, including recognizing the symptoms, managing future episodes, and preventing recurrences. Understanding the cause, identifying triggers, and preventing future episodes. Preventing future episodes of hypoglycemia requires understanding the underlying causes and identifying potential triggers. For individuals with diabetes, this often involves working closely with their healthcare team to optimize their diabetes management plan. This may include adjusting medication dosages, meal planning, and incorporating regular physical activity into their routine. It's crucial for individuals with diabetes to monitor their blood glucose levels regularly, especially before meals, after exercise, and before bedtime. This helps identify patterns and potential triggers for hypoglycemia, allowing for timely interventions. Lifestyle modifications can also play a significant role in preventing hypoglycemia. Consuming regular meals and snacks throughout the day, avoiding prolonged fasting, and staying hydrated are essential steps in maintaining stable blood glucose levels. Individuals who consume alcohol should do so in moderation and always with food, as alcohol can interfere with the body's ability to regulate blood sugar levels. By understanding the causes of hypoglycemia, recognizing the symptoms, and taking proactive steps to manage and prevent future episodes, individuals can effectively minimize their risk of experiencing this potentially dangerous condition. Understanding hypoglycemia, a shared responsibility. Throughout this video, we've explored the intricacies of hypoglycemia, a condition that can affect individuals with and without diabetes. We've learned that recognizing the symptoms, understanding the causes, and knowing how to respond promptly are crucial for managing hypoglycemia effectively and preventing serious complications. Managing hypoglycemia is not a solitary endeavor. It requires collaboration between individuals, their support systems, and healthcare professionals. By working together, we can create a network of informed individuals who are equipped to recognize, respond to, and prevent hypoglycemia. Remember, knowledge is power. The more we understand about hypoglycemia, the better prepared we are to manage it effectively and support those around us who may be affected by this condition. Empowering yourself, taking control of your health. Empowering yourself with knowledge about hypoglycemia is the first step towards taking control of your health or the health of a loved one. By staying informed, being proactive, and seeking support when needed, you can navigate the challenges of hypoglycemia and live a healthier, more fulfilling life. If you have any concerns about hypoglycemia, don't hesitate to reach out to your healthcare provider. They can provide personalized guidance, address your specific needs, and help you develop a management plan that's right for you. Remember, you are not alone in this journey. With the right knowledge, support, and proactive approach, you can effectively manage hypoglycemia and live a healthy, fulfilling life.